Hello and welcome again. So today we have discussed a lot of things about bacterial exotoxin, that the bacteria release some of the chemical substances known as the toxin outside from the cell, and that it is dispersed into the environment to the localized area where it is getting infected and then cause the infection. According, we have seen that protein synthesis inhibitor, we have seen increased fluid secretion, we have seen about the lysis of the cell membrane, inhibitor of the neurotransmitter release, and some of the superantigens. Likewise, now we are going to talk about the endotoxin. Endotoxin are the substance that is mainly limited to the gram-negative bacteria. I am again repeating, it is only up to the gram-negative, whereas exotoxins were released by both gram-negative and gram-positive. So exo is all kind of bacteria can release, but endo is only released from the gram-negative bacteria. So this makes it unique, that it is only limited to the gram-negative bacteria. And another mechanism is it is released only when upon lysis of the cell, and or sometime by living cells by bleb detachment from the outer surface membrane. So it is either released when the cell is disintegrated, dead, and then released from that cell wall, or in few cases living cells can also release this endotoxin by bleb detachment, like a body detached from it. It's a bleb detachment from the outer surface membrane, unlike of the exotoxin which was actively secreted. So all the exotoxin, either from the gram-negative or gram-positive, they were actively secreted from the bacterial cell that released into the environment that's surrounding that bacteria, and if it is in the human body, in any part, suppose in the GI tract, then it will act locally or systemically. So now we are talking about the endotoxin that is released only when the cell is lysed, or in some case, in a rare case, it has detached from the outer surface membrane of a living cell. Now, when we are talking about the endotoxin is the lipopolysaccharide found in the outer membrane of the gram-negative bacteria, both cocci and rods, composed of the O antigen, core polysaccharides, and lipid A, the toxin component. We have talked about the release, and the main effect is the macrophage activation, complement activation, and tissue factor activation. Before going into detail of the mechanism of action, let's talk about the bacterial cell wall. If you see the bacterial cell wall, you can see over here the bacterial cell wall. In the bacterial cell wall, we can see this component, that is lipid A. This is the envelope. This is the gram-negative bacteria. We have gram-positive one, but this is the gram-negative. And then gram-negative, when you see the cell membrane, cell wall, actually cell envelope, and we can say in the cell envelope, we can see that there is an extra structure. This is known as the outer membrane, and this outer membrane is only present in the gram-negative one, not present in the gram-positive one. Since this outer membrane has component like it has the lipoprotein, porins for the transfers of the material, which allow only the small particles to enter. It has the lipoprotein bridging, and the main component, that is the LPS, lipopolysaccharide, which has the three part, that is O antigen, outer surface, which is the somatic antigen. Then there is a core part, and there is the lipid A. This lipid A is the toxic component which is responsible for the endotoxic salt. So, if you want to go in detail, there are difference between the gram-negative and gram-positive cell wall. Gram-positive cell wall has the cytoplasmic membrane. This also has the cytoplasmic membrane. They have a thick peptidoglycan layer which helps in the retaining the gram state and become the crystal violet color. But in this gram-negative, the cytoplasmic membrane is there, but peptidoglycan layer is very thin. And there are other like teichoic acid and lipoteichoic acid which is not present here. In addition, there is another outer membrane which is not present in the gram-positive bacteria, and this outer membrane has lipoprotein, protein, and the major part is LPS, lipopolysaccharide, and this has a three part. One is the somatic antigen that is responsible for all antigenic structure. Then there is a core, and there is one is the lipid A. Lipid A is responsible for this is the toxic component, and it is responsible for this endotoxic salt. So we are talking about this lipopolysaccharide, and coming about the mechanism of action, how this endotoxin develop the toxic shock. This has the three main effects. It is actually causing macrophage activity. Endotoxin, that is the lipid A component, cause macrophage activation. Then there is a complement activation, and there is a tissue factor activation. So there are different activation things are going on, and Among them, if you're talking about the macrophage activation, there will be there is the secretion of the interleukin 1 and 6 that leads to the fever. Then there is a release of TNF alpha that leads to the fever and hypotension, and there is a release of the nitric oxide that causes vasodilation, and once the vessel is dilated, we develop hypotension. So the endotoxin that can activate the macrophage leads to the secretion of the interleukin 1 and 6, TNF alpha and nitric oxide. Interleukin 1 is responsible for fever, TNF alpha for the fever and hypotension, whereas nitric oxide cause the vascular permeability and then cause the hypotension. So if there is increase in vascular permeability, the blood pressures drop down and we goes into the shock. There is another mechanism that activates the complement pathway, by which there is the activation of C3A and C5A. These are the intermediate product of your complement pathway. We'll talk about the complement pathway in detail when we'll discussing the immunological chapter. So in this complement pathway activation, you can see C3A and C5A. These are releasing the histamine releaser, hypotension and edema. This histamine again causes the vasodilation and develop the hypotension that leads to the fall in the blood pressure. So in the shock and even the C5A both have this hypotensive property, and C5A has additional property of neutrophil chemotaxis. There is another mechanism by which they activate the tissue factor activation, and by which they cause the coagulation cascade to be activated. And once coagulation cascade is activated, then they will develop the disseminated intravascular coagulation. So what is happening? The end result is your patient is developing fever with hypotension, that is patient is going into the shock, that is the profound shock is predominant more, and the disseminated intravascular coagulation, the whole body, that is the intravascular coagulation and the ischemia and cells are going to die. So this is in this way multi-organ failure does occur. Let me explain you here. You can understand over here. You can see this is the endotoxin. You can see this endotoxin activity, and in this endotoxin activity, we can see there is the bradykinin, oxygen-derived free radical, platelet active factor, renal toxin, myocardial depressant factor, interleukin 1 and 6, histamine release, T1 necrosis factor release, activation of the coagulation cascade, and prostaglandin, thromboxane, leukotriene, prostaglandin release. These all are releasing that release into your body, and they all are causing your drop in your blood pressure and causing thrombosis inside your body that leads to the multi-organ failure. You can often see here is the gram-negative bacteria that release the lipopolysaccharide, which combine with the liver proteins, and then they activate the neutrophil and macrophage. Once neutrophil macrophage are getting activated, they release the histamine, nitric oxide. This nitric oxide, histamine, interleukins, these all are causing increase in the vascular permeability, and because they develop the endotoxic shock, as well as due to the intravascular coagulation, multi-organ failures are going to develop. I can show you another. You can see over here, the people are actually in endotoxin or microbial product. They are activating the macrophage, and macrophage is activated, or monocyte, then they are releasing lots of cytokines like interleukin 1, 6, TNF alpha, platelet activating factor, complement, kinin, serotonin, histamines. These all are releasing inflammatory mediator like nitric oxide, and this nitric oxide is causing hypotension by increasing the vascular permeability. BP drowns, patient is going to the shock, and then patient are developing the organ failures. You can again see this as pathogenic subseptic shock, where you have seen the microbial derived substance, mainly the lipopolysaccharides. They are activating complement factor, they are activating the tissue factor, they are activating the macrophage and complement, which we have talked initially, and they all, by this all mechanism, they are developing the multi-organ failure. Even you can see the Lancet paper published, where we can see the bacterial product has activating the neutrophil and macrophage. They are activating the complement pathway, and the tissue factors coagulation pathway is activated, and there is release of the pro-inflammatory mediator. There is the release of pro-inflammatory mediator, TNF, interleukin 1, nitric oxide. These are causing the inflammation. In severe cases, the deleterious effect is occurring, and the organ failure is occurring, developing, and there is the organ function is developed. So what happened in all these cases, when there is a lipopolysaccharide is released, they are causing multiple. The main mechanism is three factors activated, and ultimately they are causing this coagulation system is activated, where causing the microthrombosis, develop the DIC, hypoperfusion, tissue hypoxia, and leads to the multi-organ failure. They are causing the release of this proteases, oxygen free radicals, nitric oxide, that's causing the vasodilation and causing the damage. So when we are talking about the endotoxin, we have came to know that endotoxin is acting by the three mechanisms: macrophage activation, complement activation, and tissue factor activation. These three you have to remember, and by these three, they are releasing the intermediate component. These are the components that are causing the vasodilation because they are releasing the nitric oxide, which is causing the hypotension. They are releasing interleukin 1, that is causing the fever. They are looking in complement activated proteins that are releasing again histamine, causing hypotension and shock. They are activating the ovulation factor, cascade, tissue factor activation, coagulation cascade, developing the DIC. There is a microthrombosis in every vessels, leads to the ischemia to their vital organs, and the organ failure is occurring. And in this way, if the patient is developing this endotoxic shock by the LPS that is found in the gram-negative bacteria, patient is going into the shock. So you have to manage that septic shock, otherwise patient is going to die. So this is the important topic for your questions, and you have to understand it, then you can easily able to detect the questions and able to answer. Thank you.